Hello everyone. My name is Nilesh Thite and I'm representing IACL along with my colleague Ms. Lakshmi Shinde. In fact,
Hello, everybody.
we are extremely happy to participate in this lecture series by class of 2020. To begin with, we have Ms. Lakshmi Shinde. She's going to talk to you about soft contact lenses in Toric designs and how does the teaching fare against the practice. Ms. Lakshmi Shinde is a renowned figure in contact lens education. She is currently the executive manager of global education for IACL. She has a vast experience in teaching, in practice, and in training programs as well. She completed her B optometry from Elite School of Optometry, Chennai. Then she did her master's from the University of New South Wales, Sydney. Um, she she's a well-known figure in India and abroad as well. In I think recently in 2015, actually, she won the prestigious American Academy of Optometry Award for her contribution to international optometry. So over to Lakshmi.
Thanks, Nilesh. And hello, everybody. And great to be, given the opportunity to be part of IACL as well as the IACL participation in the class of 2020 lecture series. So Nilesh and me are really, really glad. And look at the medium that we are connecting with, a virtual medium across the seas, right from India towards Latin America. So great to speak to all of you, and I hope you all enjoy this lecture series. So the topic today is soft contact lens toric, teaching versus practice. I'd like to acknowledge all the industry partners of IACL, without whom we really wouldn't be here. So to start with, what should students initially know about, soft contact lens fitting in terms of the knowledge they should have prior to we starting to teach them soft toric fitting? So basically, they should know about astigmatism, the meridians of astigmatism, what causes astigmatism, and the types, and the magnitude and the incidence of it. So how many young practitioners? So this is regards teaching. So when you convert that into practice, how many young practitioners are really familiar with all of this is the question. So I think as practitioners, we all need to kind of brush our knowledge regarding all of this from time to time. That's just a Stump's conoid, where it basically explains astigmatism and also explains the different meridian of focus and the circle of least confusion, which these students should be familiar with. Now, coming to the incidence in terms of the degree of astigmatism, we find that as the astigmatism grows higher, we find that the incidence also keeps reducing. So in a population, more and more people do tend to have around 1 to 1.5 within that range, and the higher degrees of astigmatism are quite rare. And in terms of age, we always find that the younger population has more and more with the rule astigmatism, and as you grow older, it kind of becomes against the rule astigmatism, and the oblique astigmatism again are rare in both the younger as well as the aged population. So all this knowledge one should be familiar with when we actually approach soft contact lens fitting, both as a practitioner and maybe as a final year student. Of course, nowadays we do have the computer assisted map rather than the keratometer, which gives us much more information than compared to a keratometer, and it also helps us in looking at things like keratoconus and other kinds of abnormalities where the cylindrical prescriptions are slightly on the higher side or frequently changing for that matter. So we need to look at them, diagnose them early, and refer them properly to a proper type of contact lens rather than just a soft toric lens. So basically, the aim in terms of soft toric lenses is to actually bring both the meridional, foci onto the retina. That is the collapse of the Stump's conoid onto the retina with the help of the soft contact lens. So what are the different design considerations that we have when you look at soft toric lenses? We have where the different stabilization techniques, where the industry has come up with a lot of innovative methods where they can stabilize the lenses much better than the earlier generation lenses on the eye. They have the reference marks, which tells us what industry lens that is, and also the position of the mark is something that one needs to be familiar with. The contact lens thickness variations due to the prescription in terms of whether it be with the rule or against the rule astigmatism, and also with respect to the kind of contact lens design, that is the manufacturing techniques and everything, need to be familiar with the student, because all this plays a role towards soft contact lens fitting. The other good question that one needs to look at is, some of the students do wonder. So when we say that a contact lens needs to provide good and stable vision, I think the first thing that we say is the lens should not really keep moving a lot in the eye. But at the same time, we also say, you need to measure movement. So there is a confusion as to, whether the contact lens should actually move or shouldn't move. So the message as educators that we need to provide to the students is the good vision requires a very stable cylindrical axis location, but at the same time, the contact lens needs to move to flush out all the debris from beneath the lens. So what the vertical movement is something that's shown by the green tick mark, is something that we all need to have in terms of a soft contact lens fitting. But at the same time, the horizontal rotation is something that we really do not want, because that will misalign the axis of the soft contact lens. In terms of stabilization methods, these are the various stabilization techniques that the industry has come up with. And of course, the stabilization principle is a very simple principle of the watermelon seed principle, where if you keep a watermelon seed between your two fingers and you actually squeeze, always the thicker portion of the watermelon seed is flushed out first before the thinner portion comes out. So in any direction that you keep the watermelon seed, it always comes out with a thicker portion out, getting flushed out first. So that's the same principle with which the soft contact lens toric lenses are fitted. So the fingers are the lids, and always the thicker portion of the contact lens comes out first rather than the thinner portion. So this principle is what is being used in the various stabilization techniques. So this is just an example of one of them, which is called as the prism ballast techniques, one of the very oldest one. And actually, if you see nowadays, most of the companies use a combination of various stabilization techniques, be it reverse prism or prism ballast or truncation. So they all, or peri-ballast, so they all use a combination of these techniques to actually stabilize the contact lens on the eye. Practical, skills versus the knowledge that you learn when you are an undergrad. The knowledge we need to have definitely of the stabilization technique. And as a practitioner, your concentration is more on the scribe marks which are present on the lens, to make sure the scribe marks are in the position where they need to be. And as practitioners, we should also ask the manufacturer as to what kind of stabilization technique is being used, so that you are aware of the technique that's being used by that particular manufacturer. And the scribe marks also keep varying from one company to the other. So one should also be familiar with what company has the scribe marks lie in which portion of the contact lens, so that you can actually see the scribe marks when you fit the lenses and make sure whether there is rotation or there is no rotation.
Hi, Lakshmi. Let me just interrupt you quickly. A quick question.
Yeah, sure.
You just mentioned about various techniques, and also that nowadays it's not one particular technique used strictly. It's more of a combination of them, right?
Absolutely.
And in your experience, does the performance vary much with different techniques? What have you
Not
seen?
really. See, as I said, so the various industries use a combination of various techniques, and also it also depends on the kind of material that each company is using in terms of whether it's high water content or low water content, and they also kind of merge that with the kind of stabilization technique that they are using, so that it kind of balances both out in terms of the lens thickness and the kind of stabilization technique that you're using, because they all it's a marriage of many kind of factors, Nilesh. So whether the lens is a high water content, low water content, that against your stabilization technique that you use, and all of that, all that together basically is aimed at just one thing, that the lens stays stable on the eye. And practically, when you see, let's say if you fit 100 soft contact lens toric lenses, I would say as a practitioner, I would have seen at the most maybe around 5 to 6 which really rotate. So these were huge problems initially when, when toric lenses were introduced. They were late cut lenses. They were not spun cast or cast molded. They were all late cut lenses. They were thicker lenses. So lenses being thicker, they did move on the eye. At the same time, they had to look at stabilization techniques and things like that. But with all the innovation that's happened with in terms of materials, in terms of stabilization techniques and all of that, you hardly get to see that much of contact lens rotation. Of course, I'm not saying it's not there at all. It is there, and one really needs to know about what are the corrections you would do if there's rotation. But as I said, in 100, you might see at the most maybe 5 or 6.
Okay, thank you.
So in terms of, this is one company which will have it at 6 and 12 o'clock. So you need to know which company has these particular markings. One company gives it only at 6 o'clock alone. There's a different company which has markings both at 3 and 9. And some of them have it both 3, 6, and 9. And if there are two companies which have, at the 4, 6, and 7 o'clock, 5, 6, and 7 o'clock positions, but the degree of gap between the scribe marks also vary. One company has it at 30 and the other one has it at 15. So it's very, very important to know all of this and to know what company is providing what kind of scribe mark and what's the variation between them. So it's very, very important as students, all of you know what's available in the market and what's the difference in terms of the scribe marks as well, and both as practitioners and as students. In terms of thickness variations, yes, the soft toric lenses are not the same in terms of oxygen transmissibility starting from the superior to the inferior region. There is a difference because basically whatever type of stabilization technique you look at, if you go back to what I said, the principle is based on the watermelon seed principle, which means the inferior portion of the contact lens is always thicker than the superior portion, so that when you blink, that kind of, is ejected out first between the lids, and it kind of settles down at the towards the lower portion of the lids. And therefore, if the thicker, if you go down from the vertical meridian from the top to the bottom of the lens, as thickness increases, it's very natural that the oxygen transmissibility also reduces with the increase in thickness. This was an issue in olden days, but nowadays it's really not an issue with the improved materials. Earlier, we did see, some amount of vascularization and hypoxia occurring in very high power toric lenses, especially in the lower portion of the cornea. Whereas, as I said, nowadays you really don't see that much because we have better materials. And of course, with the modality as well as daily disposables. So definitely the average contact lens thickness is a much better indicator of DK by T rather than looking at the lens as a standalone. And with the rule, toric contact lenses have a lower average thickness than against the rule, especially because in against the rule, we all know that the vertical meridian is thinner than the horizontal meridian. So when you actually look at fitting of toric lenses, it's very much the same as any normal soft contact lenses. There's nothing really different in terms of you assessing the coverage of the lens, whether it's covering the limbus, whether it's centered well, and all of that. The only addition being the rotation of the lens, which all of us should be conscious of by looking at the scribe marks.
Hello, everybody. My name is Jason Nichols, and I'm the program chair for the Global Specialty Lens Symposium and our new meeting, the Global Myopia Symposium. We look forward to bringing you cutting-edge information each year, and again, we look forward to hosting you in 2021.
So empirical fitting should be the norm. The reason being, there are, even in India, if you see, there are certain practices which use trial lenses. And I really feel we need to get out from this mindset of using trial lenses for especially torics, because now it is a very, very fast changing world and everybody wants service at the quickest. So if somebody comes to you and you say, okay, why not try soft toric lenses? And if you have it within your, stock, then it's easier to just give it to them and then say, why don't you try it and teach them how to fit and remove, and then ask them to come back and, show you as a follow-up visit in terms of when you assess how the lens is performing and so on and so forth, rather than giving them a trial and then saying, no, I need to check, and then you come back and then maybe I need to change the lens and all of that, which rarely happens, as I said, in terms of rotation. So empirical fitting, I think, is the best way to go. And nowadays, companies actually support a lot in terms of, if you tell them this is an open box, there is lens rotation, can we just change it to so-and-so? There are most of the companies do take back and do replace the box of lenses as well. So if you've already opened one. So I think as far as practice is concerned, it should always be empirical fitting. And this is slightly different from what a student would look at. Maybe to a student, we always say, okay, let's do a trial. Let's see if it actually fits well. Then maybe we will dispense that. That's because they're students and they're learning. So that's the difference when you shift into a practice. You always look at quicker service and providing them with the optimal care.
So Lakshmi, that quickly brings me to my next question.
Yeah.
Which is, there was a time when we used to consider toric contact lenses under specialty contact lenses, right?
Yeah. Yes.
Today, with the advancements and the way, the things have changed and evolved, would you still consider it as a specialty lens?
No way. It is just any normal. Nowadays, specialty is gone. Specialty, I would label an ortho K or a, scleral lens fitting as specialty. Even normal RGPs is not specialty anymore. So forget soft toric lenses. Even an normal RGP fit is not a specialty. So which actually requires much more skill, I would say, rather compared to a soft toric lens. So definitely not a specialty fitting, technique. So I would say it's just a normal. As I said, it has to be something that's provided as an immediate solution. You don't wait for, a trial to be done and then you check and all of that. But it should be something like an immediate solution that you provide for patients who come, and then they can pick up the lenses and go. Of course, one might argue saying I need to have a large inventory for that. But I think it also pays back as a practice, right? If you invest in inventory, you're also getting patients. So somebody would always say, oh, you go to this practice, you can get lenses much readily than compared to somebody else's practice who has not invested in an inventory.
Okay, thank you.
Yeah. So in terms of, the soft contact lens fitting, there should be full corneal coverage. In terms of axis rotation in a good fit, even if there is slight rotation, it should always come back quickly to its position of rest. And in a tight fit, there is very, very slow, return of axis. And in a loose fit, it doesn't even stay in place. So that's very simple as what we used to see in soft contact, normal spherical lenses. One thing in terms, especially from a student's point of view, that these scribe marks that we say at 3, 9, and 6 o'clock, or 5, 6, and 7 are all marks for reference only. So we are only looking at it in terms of a reference mark. Is there a rotation or is there no rotation? It doesn't mean that if the scribe marks are rotated to a particular position, that the lens is wrong and we should not prescribe that or whatever. It's that has to be really drilled into the student's mind, because they often get confused, saying that the scribe marks have to be only in this position. If it's in any other position, you cannot prescribe toric lenses. So that differentiation between practice and the student should always be emphasized to the students, and they should learn exactly what's the right way in terms of assessing a toric lens fitting. One additional very interesting point that I just would like to highlight is that when you look at lids, okay, and when you look at the way we blink normally, the anatomy of the eye is such that when you blink, this is with respect to the right eye of the patient. This is from a practitioner's point of view. Right eye, whenever the lids blink, it tends to put a force towards the nasal. So usually the lens do rotate very, very slightly, maybe to around, less than 5 degrees towards the nasal area. And this is so also with respect to the left eye. So both for the right and the left, you get kind of a slightly circular movement because of the lid tonicity and pressure towards the nasal area. And this is very, very important to keep in mind. And I'll tell you exactly when this comes into play. So when we look at, let's say, oblique lenses, for example, 25 or 135 or something like that. So let's say we have 25 degrees placed in the right eye, okay? And we know that the industries really don't give us such kind of very oblique axis cylinders in terms of prescription. And if 25 is on the right eye, and if the right eye, we normally know that it slightly rotates towards the nose, and if you apply the last rule, it is right subtract. So in those cases, what we would do is we would say, okay, let's give 20 degrees for this person. And if 135 is there on the left eye, and we know that it moves slightly towards the nasal and we have to add, we would go for a 140. So here you would go for a 20, and here you would go for a 140. So just knowing the anatomy basically just helps in these kind of very odd oblique astigmatism cases where we have to round off the degrees and ask the companies to provide those lenses. So the fitting procedure, just to summarize, you have to measure the prescription and the vertex distance correction. If it is above 4, or if the combination is also above 4, you still have to apply vertex combination. I mean to say both the spherical and the cylindrical together. You select the contact lens power, and then after that, the base curves that are available from the various companies. Normally it's just 2, so you just have a choice of 2, as well as the diameter as well. You pick up the diameter, which normally ranges between 14 and 15 nowadays. And you fit the contact lens, look at axis, any axis location, compensate for that, and then after that, you prescribe the lenses. And you, of course, you have to apply the last rule if at all there is any rotation. So clockwise add, anti-clockwise subtract, or left add and right subtract. Left add, right subtract is from the practitioner's point of view. These are some of the difficult cases. I just put a few of them just to highlight that in terms of this, where the spherical component is very low and the cylinder is slightly high, there are slightly difficult cases. But keep in mind that the patient's motivation is a very, very, very key factor in this. So despite slight blurred vision, the patient might still say, no, I prefer contact lenses to spectacles. And really the slight blurriness of vision may not matter for this particular patient. So patient motivation is one of the very key factors before you say, okay, this patient is not going to succeed in contact lens, without even giving a trial to the patient. So you should give it a try and see how it is on the patient, whether the patient's comfortable or not. And then after that, decide whether the patient is okay with it or not okay with it, and so on. So these are some of the few difficult cases that one can come across. So just to summarize in a couple of 10 points, the history, then you check the vision of the patient, spherical over refraction and the vision that's delivered. In case the patient is not willing to, go that extra mile and, look at toric contact lenses. And also it is better to show them actually what's the difference between a spherical equivalent and a toric. If you actually do that, for example, the patient might even say, no, the one with the spherical equivalent, the vision is slightly blurred, so I'll actually go in for a toric lens. So on the trial frame or on the phoropter, you can actually show what's the difference between a spherical equivalent and the exact prescription. And in many of the cases, the patient prefers to go in for a toric contact lens than just a spherical equivalent, even if the cylinder power is just 0.5 or 0.75. And you check the movement, the stability of the contact lenses. If the lens is mislocating, then you have to compensate for the rotation and order the final contact lenses. And this is just something that's come from the industry point of view, where they do give a first fit guarantee. From many of the corporates do give that, in the sense they say, we don't see much of rotation, so we really give a first fit guarantee. If the prescription and everything is absolutely fine, then we know that the lenses really don't rotate, except for very few cases. And if it does rotate, they do take back and then replace that with the axis correction. I just wanted to bring a point across, where as practitioners, sometimes we tend to become complacent over a period of time, and we really don't address the needs of the patient sometimes, or if you've been practicing for a long time. For example, if a person comes with a 0.5 or a 0.75 cylinder, we kind of say, oh, just a normal spherical lenses will do for the person, and actually not look into a toric soft contact lens modality of vision correction. So it's really, I would say, our duty as optometrists to kind of inform the patients the various options that are available, and also, as I said, show on a trial frame what's the difference in terms of vision, and let them choose what kind of contact lenses they would like to go in for. But always inform the patient that there are multiple options that are available, especially in lower cylinders. And I just was doing some search, and I came across some of the websites. Even today, they kind of say if it is 0.75 and less than that, then you can give just spherical correction, which is really not true. So there is evidence in literature to show that the vision does definitely improve in terms of toric contact lenses. And what better way to put it than the way, in this Phil Morgan's paper, where he says, at the present time, in the majority of countries surveyed, toric soft contact lens prescribing falls short of that required to correct clinically significant astigmatism in all lens wearers, which means that we really do not give this as an option in terms of toric prescriptions as a lens that can be fitted, especially in low cylinders. This is just an example I thought we can use to actually show that the spectacle, this is what the spectacle prescription is. So I'll just give a couple of seconds for you to register what the spectacle prescription is. And so if the lens is available in just 10-degree steps, what would you prescribe in terms of, the right and left lens? So just keeping in mind the lid factor, in terms of the right eye, we would rather go in for 20, and in terms of left eye, we would order a 160, okay? And we wouldn't really go ahead and look at something like 30 and 150. That's wrong. So in the right eye, you always, because of the lids, you tend to subtract a little bit. And on the left eye, you tend to add because of the lid influence in terms of the rotation of the contact lens. The other example is just in terms of, the vertex distance correction, that you have to draw a cross cylinder and then make the correction for the toric lenses, and just not go by individual powers that are there in terms of both the spherical and the cylinder. It has to be a cross cylinder method. So this will be 9, and then you'll have to do for 6 separately. So that's how you actually change the prescription into a spherocylinder after the vertex distance correction is given. Just to summarize, I thought, this was a very, very good quote by, Dr. Long Tran, where he says, helping patients who have astigmatism can be a rewarding experience. Improvements in lens material, stabilizations and designs and parameters have made soft contact lens toric fitting more efficient and very, very predictable, which is very true. And that is why industry always tends to give you a first fit guarantee in terms of soft toric lenses. For challenging prescriptions and demanding personalities, toric fitting success goes beyond just the last rule, which is very, very true, as I said, because you have to look at how motivated the patient is. An understanding of both patient's visual demand and diagnostic test results can help you achieve better fitting success. Take the time to tackle the tough toric fits. Your patient will appreciate it. Absolutely, very, very true in terms of practice, that you have to know what the patient needs. And then, once you service the patient needs, I think you always become a better practitioner. So thanks for the lovely, lovely opportunity, and thanks for your attention. I hope I was able to convey in this short time whatever was, required by me through this lecture. Over to you, Nilesh. Any other questions?
No. Thank you so much, Lakshmi. I'm sure all those who are attending would have benefited tremendously. So we just want to wish you all the very best for the class of 2020. And we want to say gracias.
Yes, gracias. Absolutely. All the best and gracias. Thank you.